Hi, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. So happy we could have some time with you today on this Tuesday. We are spending time today focused on a very, very important message connected to our mental health. September is Suicide Prevention Month, and I'm hoping that you are getting lots of information about this very important topic from different places and spaces in your life. But here is one more for you. And what's wonderful about YWTV, as you know, is it gives you the opportunity not only to watch it, but to share it with people within your circle. It's so easy for you to do by just sharing it through social media, sending the link to someone in a text. But there's going to be so much truly life-saving information that we're going to talk about today. And it's something that you should really think about integrating and sharing within your circles. So with that, I want to ask you an important question. Did you know that on an average, 130 Americans die by suicide every single day? And that it's the 10th leading cause of death overall. Over 12 million Americans have serious thoughts about suicide. And today we are going to have the opportunity to talk with Shelby Klein. She is the director of the Division on Mental Health Services for the County of Bergen, which is under the Department of Health. And she is going to share some tools, resources around mental health, and we're just going to talk about this issue. She is going to also talk to us a little bit about how in her work, they are reaching out to local communities in an effort to raise awareness that mental illness is not a disease. That mental illness is a disease. It is not a choice, and that it's something that we really have to work on still after all of this time, breaking the stigma and helping people feel comfortable to talk about what's going on and get access to services. As you can see on the screen, we are sharing the hotline. So you can make a call if you or someone you know might be contemplating suicide, and we will be sharing with you lots of resources throughout this broadcast to be able to access services. Before we jump in, I want to tell you a little bit about Shelby, who's leading the efforts to assure that all residents have access to mental health care through planning and oversight, system coordination, public education, and advocacy. She serves as a designated liaison between state, regional, and local planning bodies. She herself has over 20 years of nonprofit experience working in various settings, which are nearly all public health related and focused on guiding strategy. Most of her career was spent at Care Plus New Jersey, a behavioral health organization that's based in Bergen County, where she was the Senior Vice President of Development. She also serves on several nonprofit boards as a trustee and provides executive leadership there as well. One is for the Center for Hope and Safety, which is Bergen County's state designated entity to provide domestic violence services for Bergen County. She also previously served on the boards of Bergen Newbridge Medical Center and the Greater Newark Healthcare Coalition. And so with that, we would like to welcome Shelby to YWTV.
Thank you, Helen. I appreciate the invitation to come today, especially since it's Suicide Prevention Awareness Month.
Well, I mean, this is a conversation we should be having year round and elevating and making sure that people have access to the resources, because we know that, the statistics show that, people are contemplating suicide on, very regularly. It's not dedicated to 1 month, unfortunately. It's happening all the time. And so it is really important that we're talking about mental health awareness and ways that we can support those around us who might be struggling. So I really do appreciate you taking the time. And I think the thing for me that is the most challenging with this particular issue is that people may be struggling in silence, right? They're not talking about it.
Right. And something as serious as suicide is very much preventable. So, going back to some of the statistics that you were mentioning, and I know are being posted, when you really break down the numbers, it's about 150 people per hour who attempt suicide in the United States. And out of that 150, 5 per hour die by suicide each and every day. And as I mentioned, while it's a complex health issue, it can be prevented. And unfortunately, with suicides, it's the second leading cause of death for young people, ages 10 through 34, and it's the 10th leading cause of death overall. And so I'm glad to have the opportunity to talk about some of the factors, the risk factors that may, contribute to those attempts, to those thoughts, and to those deaths by suicide, so that everybody feels more comfortable talking about suicide, and everybody knows that it's something that they should take seriously and they can help another person.
Yeah, I mean, the age range of 10 to 34 being the second leading cause of death in that age range is mind-blowing. I mean, you think about such young children, really spending a lot of time in their space right into, that adulthood, right into that launch of middle age, that this is so present.
Right. And especially for, as a mom, especially for like the younger kids, it's not unheard of for somebody to feel such pain and despair, to be successful in a suicide attempt, or to even attempt it. It shows that we need to have this conversation today, so that we can work on improving those conversations, and we can reduce those numbers overall. I know it's not just a county priority, it's also, I know in New Jersey, a statewide priority as well.
Right. So let's talk about that. I mean, I know as the director of the Division on Mental Health here for Bergen County, you have a campaign and, a focus right now on this work. Can you talk to us a little bit about your goals for that campaign and the work that you're doing right now?
Sure, of course. In Bergen County, we have a suicide prevention task force that my department leads through staff. And that task force brings together different stakeholders that look at our communities and identify different ways and different strategies to combat and as I said, to prevent suicides. So with that, we're providing education. We do a lot of work with the schools and outreach to the schools. They identified suicide as one of their priority areas, at least the counselors in the schools, to learn more about. So we're bringing training to that personnel so that they have the tools and can share with their colleagues to engage kids in a different way. We also provide public education around suicide prevention. Tonight, we're hosting a forum called Talk Saves Lives with the American Foundation for Suicide Prevention. And, it's an opportunity to just increase awareness among the general public around, some of the things that we're talking today about. What are the risk factors? What are myths? What are the statistics? So people feel comfortable having those conversations. And we'll also bring some clinical training to clinicians, because again, it's a subject that a lot of people are not comfortable talking about, and don't know how to respond, even with a survivor. So we want to make sure that we're addressing the entire community, so everybody has some type of a tool that they can use to be part of the solution. I can't hear you.
For our viewers, thank you. We had a train go by here, so I put myself on mute so everyone didn't hear it. So, but for our viewers, we put here on the comments the opportunity for you to register for the event that Shelby just mentioned, called Talk Saves Lives, an Introduction to Suicide Prevention. So this is this a virtual program?
It is a virtual program. It's about 45 minutes in length, and then it has a Q&A session that follows. It's an opportunity where when you join, you don't have to show your screen or your name if that makes you more comfortable. The idea is to join and learn and listen. It is a free event, but registration does need to be completed by 4 o'clock today in order for us to get the link shared with those who have registered.
Great. Thank you for sharing that. So everyone, the information is here. So whether it's for you or someone in your life that you think could benefit, the reality of it is anyone could benefit from just learning about suicide prevention. Again, whether it's for you or for someone in your life or someone that you may come in contact with, you just, again, the statistics show that this is, likely on the mind of someone within your circle. And so, the more, whether, the more information that we have, the more we have the ability to prevent. So I think that that's an interesting thought, though, that we can prevent suicide, right? Because I think, we think about it as, after the fact and not what's leading up to that, right? Is there anything that we can share with our viewers that they, should be thinking about, what they should be looking for, and what they should be thinking about so that we can make sure that we can help people seek help early on in their struggles and not let it get to that point?
Absolutely. So there's risk factors and there's also warning signs. Within risk factors, we tend to categorize them into 3 categories. The first is health risk factors. So that's, whether a person already has a diagnosis of depression, a substance use problem, a serious chronic anxiety type of disorder, or a serious head injury. Those are like health-related risk factors. Historical risk factors include a family history of suicide, family and friends, childhood trauma experience, and previous suicide attempts as well as is a historical risk factor example. Environmental risk factors are things like access to lethal means. So if the person owns a gun or has access to a gun. Prolonged stress is an environmental factor. And with COVID, I think we're all feeling a little bit of that prolonged stress. Or a stressful life event, maybe, 5 major things just happened in life and it's just a lot to bear on a person. So those are our risk factors. In conjunction to risk factors, there's also warning signs to look for. So, and that might be signals that a suicide attempt may be imminent. One is, behaviors changing over time. However, it doesn't have to change over time. It could just be sudden as well. Talk. People who are thinking about suicide often talk about ending their lives directly or indirectly in a serious way or kind of off the cuff. They might say outright, what, my life is really hard and I'm thinking about committing suicide, ending my life through suicide. And another person might say, and make a joke about it and say, this is, it's just, I may as well die, or, and it's kind of like off the cuff and you're like, oh, they're not being serious. But no matter how it's presented, it should cause that moment to pause and say, hey, let's just check in on this. Behaviors, as I mentioned, isolation from family and friends in particular, where you're not seeing or hearing from that individual. Things like increased substance use, alcohol or drugs. If they're not sleeping well, that's also a behavior. Or if you realize that they're acting recklessly, giving possessions away, really a lot of that withdrawal activity also are warning signs that are behavioral. Mood also is a warning sign. If they seem to be depressed, have maybe anything from apathy, where they're kind of not really showing any emotion, to rage and irritability. So again, it's what's their mood normally like, and how is it different? So those are kind of the risk and warning signs. But there's also these protective factors that can play a role in whether or not somebody really makes an attempt or completes a suicide. And one is access to healthcare, mental health care in particular, somebody to talk to. And there's warm lines. I believe that the National Suicide Prevention Hotline number was being shared. Yeah. Family and community support. Again, it's about talking to somebody and them having a few tools. They don't need to be the professional that has to be able to know what to do, but them knowing that, okay, let me stay with you and talk with you until I'm able to get a professional to you and make sure that you're safe, is what that person's role is. Cultural and religious beliefs also play a role. For some folks, this would bring shame, so that would prevent them as a protective factor. But at the same time, religious or cultural beliefs could be a barrier to getting care. So it's kind of it plays both ways. But it is something to take into consideration as to what that level of risk really is.
So I think that kind of the average person, if someone were to say, I should just kill myself, goes through a range of responses in their head. To one is they're not serious. Mm-hmm. Two is I'm not really equipped to be able to take this on, so I'll say nothing. What are some things? What are some how could you speak to someone who might be on the receiving end of that? I mean, you just talked about all those protective and risk factors. For those of us that might be on the end of receiving and hearing something like that, obviously knowing these hotlines and knowing some of these tips are key. But what else could we tell people that might be in a situation where something like this is shared with them?
Sure. First and foremost, always take it seriously. Until you know more information. And in doing so, there's a variety of ways that you can connect with that person. If you're in a public setting, you can find a way to talk to them privately. You should be comfortable explaining what you're seeing and hearing and how that concerns you. Kind of put it right out on the table. Listen. That's a very, very important role people can play, is listen to that person, hear what they're saying, give them the time to tell their story as to why they're at this point. Express care and concern. And as I mentioned, kind of right up front, like be direct about it, with putting it on the table and use the word suicide, ask, do you think that you might kill yourself? Do you have a way to kill yourself? And then it's about connecting them to resources. And while those connections are being made, obviously, if it's a very urgent situation, you're going to call a 911. In Bergen County, you can call 262 HELP, which is the crisis center for Bergen County, and there's one in each county in New Jersey. But you don't want to leave them alone until you know that they're safe, and you don't ever want to minimize those feelings. You don't want to say, "Oh, you're just joking, right?" You're not really serious, because when you use that kind of a tone, they'll take it as, "Yep, I was," and kind of shut that door when the door was about to be opened. So you also can talk to them about how their life is worth living, even if they're going through something really difficult. There's always an opportunity to kind of refresh and restart your life, as difficult as that may be. That there is that opportunity. So you can offer that advice to them. If they do have access to lethal means, in addition to calling 911, if you're able to remove that access, so if there's a gun in that person's household, being able to make sure that that's taken away and kept away. I do think that there's programs where you can actually kind of check your gun in. I don't know if that's with police departments, but I've heard of programs where you can kind of check your gun in into a safe place until you're ready to kind of retrieve that again. You can literally drive them to services because a lot of times when people make appointments, that doesn't always mean they're going to follow through because they might be nervous or anxious about what does this mean and am I going to be stigmatized? To really provide that support and making sure that handoff happens is important as well.
That's great information. And can I ask, I mean, you talked about the ages 10 to 34 timeframe, or age range, I should say. The information that you just gave, is that the same for like a 10-year-old and a younger child? Is that, if you're hearing a youngster in your life share something, that's a concern?
Yes. So obviously the emergency numbers are for all ages, whether that's 911 or 262 help. And same with the warm line. There are additional resources for different age ranges as well as different cultures. If people are looking for different warm night lines that specialize in different things, there are opportunities or resources, I should say, out there. I don't think I shared those ahead of this program, but I do know that they exist for the different age groups. But in an emergent situation, the front door is the same across the board.
Got it. And again, we have the phone number has been put on the screen here for you throughout our broadcast. And we actually, I think we'll put the phone number in the comments as well. And that way, you don't have to wait for it and it'll just be there for you. Again, we encourage everyone, if you can, to take time to register by 4 p.m. today so you can be part of the important event tonight. And again, because this is the month, and again, thank you. We have the 262 help number here for you, which is a 24/7 crisis hotline. If you or someone in your life is contemplating suicide, so that you can get some direction and support to be able to work through that with them. But again, this is a month where a lot of resources and data and information is highlighted around this issue. So, there are, lots of opportunities right now to be able to get information. But know that, Shelby's department at the county is, there year round, supporting this work, in our community. And there's so many opportunities through local initiatives, mental health support, and, these hotline numbers. You are not alone, whether you're trying to figure out how to help somebody else or whether it's for you. There is someone here to help bridge you through the moment, get you help and support to help prevent suicide.
Yeah, and I think it's also important to note, as I alluded to, working closely with the schools and school personnel, we work with a lot of different stakeholders in the community, including law enforcement. So that those officers are trained, when they're outreaching a situation, and they know how to then engage the individual that may be contemplating suicide, and or know how to engage the survivors of a suicide attempt. Again, in line with Suicide Prevention Awareness Month, one of the things that we're doing is distributing comfort bags to the local police departments and emergency personnel. They'll actually start getting distributed next week, because the idea is that you've encountered this situation, and there's whether the person has survived the attempt or there's loved ones that have survived the completed suicide, to provide them a literal bag of resources, a warm, comforting blanket, some stress relief activities in that book, some journals. It's just another way to provide that type of support during a time that is very tragic and difficult for all of those involved. And so we really work hard to work across stakeholders, and we really invite all stakeholders to come to the table with us and receive the different training opportunities we provide, whether through Suicide Prevention Awareness Month or throughout the year when we do like mental health first aid trainings for the community. And other educational events. We encourage everybody to have those conversations with us because, stigma is still very much a part of a barrier to good mental well-being. And we want to make sure that those conversations continue. And we're very fortunate. At the same time, it's an unfortunate situation where it's been in the media, especially with various famous people and athletes, even more recently. So they're helping us break some of that stigma and make sure that those conversations are happening. But we're very much focused on making sure people are aware of the resources and that they really understand what mental wellness is. For everybody has mental health. And there's people who also have a mental illness. And we all need to take care of our mental well-being. And a mental illness is not something to be ashamed of. People aren't ashamed if they have diabetes and they talk about, their sugar levels. They should also feel comfortable about helping others understand what a mental illness is and how it impacts their life and how they're also a normal person. And they're living with a mental illness, but they are not the mental illness.
Right. Well, the statistics show that there are many, many, many people living with mental illness and, severe stressors, that could, warrant us needing suicide prevention supports. So, the more people feel comfortable talking about it, the more we can create a climate that this is a conversation that is okay to have, and that you're not going to be labeled in some way, and will bring us definitely to a different place in terms of treatment help, and then really impacting the numbers and decreasing the numbers of suicides and increasing the numbers of people getting more proactive wellness mental health care for sure.
Yeah, and especially now, as I mentioned before, the impact of COVID. I know Hurricane Ida impacted a lot of our communities as well. Those are major stressors that you don't need to kind of take on all by yourself. And I do know that demand for services is at an all-time high right now, which makes it tricky to access services. But there's a lot of resources out there, and our office is always happy to connect people to the local resources.
Well, folks, I hope that you stay connected with Shelby and the work of her department. You can not only connect with the work that they're doing this evening at their event, but also you can go to the county's website and you can, stay connected, as Shelby shared, throughout the year. There is lots of opportunity for programs and resources and supports for you, not just right now. And one of our viewers is sharing, and I really appreciate you sharing this, Lucy, is that, very often if people have not suffered severe depression or hopelessness, they really don't understand why it's hard for people to talk about it, even if it is to friends. So that's a really good kind of moment for those who have not suffered and felt in that space, not to judge and not to question, but to create an empathetic space for those around you, just to be able to be open and to share, and not to judge and not to comment back, but just to listen and try to support them and get them resources. So I thank you for sharing that. I think that very much is an issue why a lot of people don't talk about it as well, is that they feel like people are not going to understand because of reactions they may have received in the past.
Right.
For sure. So again, we want you to think about registering for this evening's event. You just have to do it by 4 p.m. so you could get that virtual link Again, it's Talk Saves Lives, an Introduction to Suicide Prevention, and it's being hosted by the Division on Mental Health. With that, we also encourage you to connect to the website, learn more about the programs. If you or someone in your life needs some help during an immediate crisis, please reach out to 201-262-HELP. There's always someone there to answer that phone who is trained crisis counselor to be able to support you through a difficult time and get you through it and help connect you to resources from there. Shelby, thank you so much for talking about this topic with us today. I hope that we have educated our viewers and, hopefully helped create a space like our viewer Lucy has shared, that a lot of people who don't understand, may not, end up feeling like a safe space for people to go to. Hopefully we've created a little bit more understanding and a little bit more empathy and the ability to be able to, feel like a safe place for the people in your life, and also to help you find a safe place if it's something that's going on in your mind. Again, whatever age someone in your life is dealing with this, there are resources available to be able to support you.
Thank you, Helen, very much for helping us raise awareness in the community. It's a very important message for us to get out, and very happy that the Y is willing to partner in that messaging with us.
Well, we are, and we hope to keep talking about it with you, about this initiative and other initiatives, important initiatives that you and that the county are bringing forward through your work. And for those of you that are, with us at YWTV for the remainder of the week, as you know, we're always, uplifting important conversations. Tomorrow we'll be talking to Pat Saporito from the SCORE North Jersey chapter at 11 a.m. And it's a great program, and I encourage you to learn about it. It probably is something that you or someone in your life might be able to utilize. And on Thursday, we do another Share the Mic Now, and we are going to be meeting Lola Gail Patrick Odine. I had the opportunity to meet her recently, and she's, an amazing woman, and I look forward to her sharing her story with all of you. Also, we want to make sure that you are connected to our website so that you can learn about upcoming YW programs and events. A few just to be able to put on your calendar. September 30th at 6 p.m. I'm Not Your Superwoman, Dismantling the Stigma Around Black Women's Mental Health. Just, kind of another piece of this conversation. We have a wonderful free and intergenerational discussion on Black women and mental health that we'd love for you to register and be part of to learn. We encourage any survivors of sexual violence to reach out to 201-487-2227 to reach and get support. We have all kinds of services from counseling to creative art support to be able to help sexual survivors deal with their trauma and also to support their loved ones. So we encourage you to reach out for that. And for our seniors who are really, very many of them feeling very isolated and especially stressed during this time that we're in right now. We encourage you between now and November 1st, we have our Healthy Minds, Healthy Life free teletherapy support group. Mondays at 11, it is free. And Sarah Hiller Burson, who is with the Center for Purposeful Aging, is a wonderful resource and has been running that group for us and really helps seniors find a voice and be able to create a safe space for them to talk about their feelings, experiences, and philosophies of life. So we have lots of opportunities to support your mental health at the YWCA of Northern New Jersey, in addition to lots of other great programs, all you could learn about at our link. We wish everybody a great day. Thank you for joining us. Shelby, thank you again for being with us. And we thank our viewers, especially those who joined us with comments today. And we wish everyone a safe day. And please, again, know that these resources are available for you in your community. We care and we want to see you supported to be able to get through a difficult time to a better place. Thanks, everyone. Be well. Take care.